everybody. I'm Dr. Michael Nusbaum.
And I'm Dr. Daria Klachko Totten.
And welcome to HealthTalks. What are we talking about today, Daria?
I want to talk a little bit about irregular bleeding when it comes to women in reproductive age.
Vaginal bleeding.
Vaginal bleeding.
Okay.
Yes. Uterine. Vaginal bleeding.
Okay.
Yes.
Gotcha.
Okay. So I want to talk about what happens when the periods are irregular, what tests usually get done, and what can be causing this abnormal bleeding.
Okay.
So again, I want to kind of talk about the women in reproductive years. So generally periods, like normal periods, are 24 or more days apart. And we always look at from the beginning of one period to the beginning of the next. So not end to beginning, it's beginning to beginning. So 24 to about 38. Yes, but there's nobody's kind of perfect on when they get their period. Very rare that somebody says, my period comes every 28 days. So there's a give and take of days.
Okay.
So generally that span is between about 24 to 38 days. And that's considered a normal period.
Okay.
Yes. So when the periods are less than 24 days or over 38 days apart, that's something, especially if it's recurrent, is something that we have to look into to see what's going on.
Okay.
So when you go see your doctor, they're going to take a history and kind of find out, like, when did you start your period? When did you start noticing the irregularity? What's normal for you? And then kind of get into why this could be changing.
Okay.
We also want to look at flows. How long is the flow? How heavy is the flow? And generally considered normal is less than 8 days, 8 days or less.
So are we talking about a change in flow or change in the length of the flow and the heaviness? That's concerning?
Yes.
Okay.
Yes, it can be.
Okay.
And then are you getting any bleeding in between the periods? So that's something also to look out for. And sometimes it can be normal to have a little bleeding in between the period, especially when you're ovulating. So you ovulate a couple weeks before the period actually comes, and around that time, because of the changes of the hormones, some women experience a little bit of staining during that time. But it's usually specific to 2 weeks before the period comes, and usually it's within that cervical mucus that seems to get thicker and more elasticy during that part of the period.
Interesting.
So any kind of bleeding in between, it's always good to tell your doctor about, so they can kind of see, is this something that we need to look into, or is this kind of normal? But so if your periods are coming less than 24 days apart, longer than 38 days apart, there's bleeding in between periods, you're getting really heavy flows, changing a super tampon or a pad every hour, or the periods are lasting longer than 8 days, definitely something to go see your doctor about and discuss.
How do you know the difference between a change in your period and maybe an early termination of a pregnancy? That maybe you were pregnant, but it didn't take, and then you have all this clumpiness and everything coming out. How would you know?
Usually in that circumstance, the period would come later. You might start to have more side effects, maybe some more breast tenderness because of the pregnancy hormone. And then the period would become, heavier. It would be, as you said, more clumpy. You might see some tissue. It might be more crampy. So that can kind of tell you, but if in doubt, you could always take a pregnancy test. So, with irregular bleeding, some of the workup is, let's make sure that there's no pregnancy or you're bleeding abnormally because of pregnancy.
I'm asking that because maybe if you think there's a chance you could have gotten pregnant, and you're having a change in your period, maybe do a pregnancy test first before you jump into your gynecologist.
That's really great. If you think that you could be pregnant or there's a risk that you could be pregnant, that's something that definitely you should take a urine pregnancy test to see, and that's a good thing to do before you call the gynecologist's office.
Well, if you were only pregnant for a couple of days and it terminated, will it still be positive?
It depends. It depends on how high. I mean, pregnancy tests are pretty good at detecting hormonal level. So it depends, a couple days in, you might get a positive pregnancy test, or you might not, depending how that pregnancy was developing. So other things that you want to look at is what could cause abnormal bleeding would be things like fibroids, which are benign growths in the wall of the uterus that can sometimes push into the lining of the uterus It can cause heavy bleeding.
And those could be
intramenstrual bleeding.
inside, but also outside of the uterus,
Oh,
right?
yes, absolutely. I
Okay.
mean, let's talk a little bit about that. So it's generally, a fibroid comes from one cell, one muscular cell in the wall of the uterus, and that kind of starts to grow and grow. And it grows into like kind of like a ball. And they can range from being really, really tiny to, I mean, I once removed one that was 9 pounds. It was the size of a baby.
You spank it?
You know, a big baby. We sent it over to the incubator. No, but they can be really large. You can have one, you can have multiple, and they're very, very common.
Do they cause pain?
Sometimes they can. It depends on where they're placed and what kind of problems they can cause. Sometimes they can cause no problem at all.
But they can cause bleeding.
Absolutely. So some of them that are located closer to the cavity of the uterus,
Okay.
so inside the
lining.
lining, can push into the lining of the uterus, or sometimes they grow like kind of right there into the cavity, and those can be removed, you know, through the vagina in the uterus and kind of like scrape those down, so they can be removed. But they can cause issues with bleeding for sure. There's also polyps that can grow. So polyps are, you know, benign growths that kind of like almost like a finger-like projection that goes into the cavity of the uterus. And that's kind of doesn't allow the lining as it's growing in the uterus to kind of stick in that area, so you can get that abnormal bleeding. Again, can be easily removed through a procedure. That can cause it. Sometimes there can be abnormalities of the uterine cavity that just have developed from birth. Some septums. You can have abnormalities of a septum transversing, like going inside the wall of the uterus, that can cause abnormal bleeding. So there's structural reasons why you can have abnormal bleeding, and all those can be checked by diagnostic tests like ultrasounds. There's different types of ultrasounds that you can actually put fluid into the cavity of the uterus and have the uterus kind of open up, and then you can see actually inside the lining of the cavity. And there's also, you know, surgical procedures that you could directly look into the uterine cavity to detect these abnormalities. So there's definitely structural abnormalities that can cause abnormal bleeding.
So if you're having bleeding, what are the takeaways? What do you do?
Well, it involves seeing your doctor and blood tests, because there's some hormonal changes that can cause abnormal bleeding. Certainly perimenopause, menopause can cause it, thyroid disorders, certain blood dyscrasias, increasing in prolactin, which is a hormone secreted by the brain. So there's definitely other hormonal reasons why you can develop abnormal bleeding. There's infectious reasons, cervical infections, uterine infections, a whole slew of things. So irregular bleeding really deserves a call to your doctor, your gynecologist, and a visit for a workup. And it's important to do.
So don't let it go. If you're having irregular bleeding,
Yeah.
see your gynecologist, find out what's going on.
Yes, and most of these can be treated. Most of the time it's going to be fine, but you want to make sure that nothing serious is going on, and you need to get checked.
Great advice.
Thank you.
All right, I'm Dr. Michael Nusbaum.
Dr. Daria, Klachko, Totten.
And thank you for joining us at
HealthTalks.